Hi there, my name is Kayla.
And I'm Sam. We are nursing students here at Bow Valley College. As nurses, we give lots of different medications like injections, oral meds, topical meds.
But today we are going to be talking about oral medication administration.
We will be teaching you how to read a MAR, doctor's orders, the 7 medication administration rights, and more. Let's get started.
For each medication, we have 3 medication checks we need to recite. Each check consists of 7 rights, and they are done before we get the medication ready, after the medication is ready, and right before we give the medication by the patient's bedside. Basically, we cannot give medications without knowing and understanding the 7 rights. First right is the patient. Who is getting this medication? Second is the date and time. When is this person going to get their medication? Third is the medication. What are you going to give? The fourth is the dose or the frequency. How much of this medication are you to give and how often? Route is how the patient is receiving this medication. Reason, why are they getting this medication? And documentation, you must document that the medication was given properly. These rights must be memorized and understood. It seems like a lot, but it is really very easy.
So once you know the medication rights, you will be able to read a MAR with ease. MAR stands for Medication Administration Record. It is a record of all the medications that a patient is currently on. When doing your first check, you will follow along with the doctor's orders and compare both documents. So here we're going to start with the MAR. So this is what it looks like. We have all of our patient information right here and our medication right here. And here's our doctor's orders as well. And that's what that looks like. So we're going to start here. So I see we have Jason Johnson. Hospital ID number is 123456789. So now let's compare it to the doctor's orders here. So we have Jason Johnson 123456789. So we know we have the right patient. The date is July 7th, 2014. So here is the 7th spot of my MAR. You can see nothing has been filled in yet. And then here on the doctor's orders, we have it's ordered for July 7th, 2014. So perfect, same date and everything. And the medication we are going to give is going to be acetaminophen. And we have it here on the doctor's orders as well. So acetaminophen, we're going to be giving 325 to 650 milligrams every 4 to 6 hours PRN, which means as needed. And of course, here we have the exact same thing on the doctor's orders, every 4 to 6 hours PRN, and it's 325 milligrams to 650 milligrams. And it says PO, so per oral, we're going to be giving the medication orally. And the reason we are giving this medication is because our patient is in pain. So right after I give the medication, I will document my initials right here in this day 7 spot of the MAR. So now, of course, in a real-life scenario, we would go into the patient's room and assess them before giving them medication. However, for the purpose of the video and skills testing, we are going to focus on the actual skill of administering oral medications.
Alright, now that we have finished our first medication check and we know what we are giving thanks to the nurse's previous report, we can go get our medication ready. While we are in the medication room with our MAR and doctor's orders, we are going to go and get our medication ready. After you get the pill and put it in a med cup, you'll do your second med check. Only this time, it is the MAR against the pill and its package. Recite the 7 rights of medication administration again, making sure to compare the MAR with the package of the pill and the pill itself. And now it's time to do our second med check in the medication room. So you're going to take your MAR and your medication. Alright, and now you're going to verify the patient. So you're going to go Jason Johnson, hospital ID 123456789 and 123456789. And today's date is July 7th, and 2014. And we will be giving acetaminophen 325 milligrams. And we can give 325 milligrams because it's in between the range of 325 and the 650. And it's going to be every 4 to 6 hours. And it's safe to give. And then the route is going to be oral. And the reason is because he is in pain, and then I will document accordingly after the medication is given.
Okay, awesome. Now that we have done our first 2 checks in the medication room, we can go into our patient's room for our final check. Make sure to bring your pill, which we're going to put in a cup. Make sure you bring your pill and your MAR along with you. So once you're in the patient's room, introduce yourself, of course. Make sure to provide privacy, check the bed breaks, and don't forget to wash your hands. That's very important. Explain what you are going to do before actually doing anything. And check the wristband. You will fail your skill if you do not check the wristband. Don't forget to compare it with the actual MAR itself and make sure to do 2 identifiers along with their name. So their birth date and their hospital ID. It's also a good idea to ask what their actual birth date is and let them tell you, and then you for sure know that it is the right person. Okay, so before we can actually give our medication to our patient, we need to do one more med check, and that's going to be using the MAR against my patient's wristband here. So, and just for this video's purpose, we're going to pretend that Kayla here is my patient. So just with our normal MAR, we're going to be using the information box, the patient's information, and then the medication right here as well. So we're going to start with the name. So we have Jason Johnson. Hospital ID is 123456789. Now I'm going to check my wristband here. So Jason Johnson. Hospital ID is 123456789. And I'm just going to ask a question here to my patient. So when is your date of birth?
February 29th, 1968.
Perfect. You look great for your age, by the way.
Thank you.
Okay. So, the medication was ordered for July 7th, 2014, and today's date is July 7th, 2014. So, it is safe to give. The medication we are giving is acetaminophen, which is Tylenol, and we're going to be doing 325 milligrams. And it's going to be every 4 to 6 hours, PRN, which is as needed. So, since we're giving the acetaminophen, we need to know why we're giving it. It's because my patient here is in pain, so we're going to be giving it for that reason. It's also a PO med, that is one of your rights. So it's a pill. PO just basically means as a pill form. So there's our pill there. And the last thing, but not least, is documentation. So as soon as I give the medication and it has been swallowed, I will go ahead and sign and put my initials right onto the MAR here. That way no one else can know, or no one else will give the medication because they will know that it has already been given. Okay, so don't forget to provide 3 assessments and 3 teachings as part of your skills testing. Have your drug guide with you to understand the therapeutic effect, contraindications, and possible signs and symptoms.
Some examples of an assessment could be a swallowing assessment, any allergies to the medication that they may have, when was the last time that they took this medication, and considering that they are in pain, we can do cold spot. Some examples of teachings, depending on the medication, are if you feel some side effects that are itchiness or drowsiness, you can always check your drug guide to find out. If you feel like you're having shortness of breath, you could be having some sort of allergic reaction. Make sure to swallow the pill and not chew them, and make sure to swallow the full dose if giving a liquid medication.
After providing your teachings to your patient, make sure you sign the MAR right away with your initials, SPN after. After that, you can provide the patient with the call bell, let them know that you will continue to monitor them throughout the day. Also, don't forget to ask if they have any questions, and if not, you can let them know that they can ring the call bell for you at any time. Before leaving the room, make sure you wash your hands.
Now that we have explained the whole procedure, we will demonstrate it for you.
Okay, so here we are in the med room. First things first, I'm going to compare my doctor's orders with my MAR here. So, it looks like my patient's name is Jason Johnson. Hospital ID is 123456789, 123456789. Date of birth is 1968, February 29th, 1968, February 29th. We're going to be giving acetaminophen. Doctor has ordered 325 to 650 milligrams, 325 to 650 milligrams. PO is the route, PO is the route, and it's going to be every 4 to 6 hours as needed, every 4 to 6 hours as needed. And the medication is also ordered for July 7th, 2014, July 7th, 2014. It looks like it has not been documented yet, so it is safe to give. And the reason I'm going to give this medication is for pain, since my patient is in pain. Okay, so now that we have done that, I am going to put my doctor's orders aside here, and I'm going to do a check with my actual medication itself. So I got this medication from Mr. Johnson's medication drawer. So we have the acetaminophen. So it's for Jason Johnson. Jason Johnson. 123456789 is the hospital ID. His birthday is 1968, February 29th. Okay, and the date today is July 7th, 2014. This is not expired, so it is good to give. We have acetaminophen, 325 milligrams, 325 milligrams. It's going to be delivered PO and every 4 to 6 hours as needed. So we know here by looking that one capsule is 325 milligrams. So we'll just need one of these. Okay, so, and the reason I'm giving this medication is for pain. My patient is in pain, and I will document with my initials accordingly when I am all finished. So now I'm just going to go ahead and get my med cup here. I'm going to get my medication out of its package. Perfect, so just one capsule there. The lid back on, and we'll put this back in his med drawer. Yeah. Okay.
What?
So now we are going to go to the patient's room. Hello, Mr. Johnson. My name is Sam, and I'm going to be your student nurse today. It's nice to meet you.
Hello.
Hi. So I'm just going to provide some privacy for us today. So I'm just going to close the curtain. I'm also going to wash my hands, and I'm just going to check the bed breaks here. Okay. So if you don't mind, I'm just going to can check your ID band here. So Jason Johnson, 1, 2, 3, 4, 5, 6, 7, 8, 9. 1, 2, 3, 4, 5, 6, 7, 8, 9. And can you tell me your date of birth, please?
February 29th, 1968.
Perfect. All right. So I'm just going to make sure that I do have everything right here. So I have acetaminophen for 325 milligrams, which is one capsule. It's a PO med. I'm giving it to you every 4 to 6 hours as needed. The date is July 7th, 2014. And has not been given yet, so it is safe to give. All right, perfect. And I'm going to be giving you this because I hear you're having some pain.
I am.
All right. So what would you rate your pain out of 10?
An 8 out of 10.
An 8 out of 10? Okay, so I'm just going to do something called cold spa. So can you tell me the character of your pain?
It's sharp.
Is it a sharp pain?
Yeah.
All right, and when did it begin? What was the onset?
Yesterday.
Yesterday? All right. And the location exactly?
My forearm.
Your forearm? Okay. And the duration, has it been constant?
It's been constant.
Constant? All right. And the severity, you said it was an 8 out of 10, right?
Yeah.
Perfect. Well, not perfect. I mean, you are in pain. And the pattern, does it hurt more when you move it?
Yeah, when I extend it.
When you extend it? Okay. All right. And any associated factors, do you think?
No.
Okay. Perfect. And I also see that you don't have any kind of allergy bands on you, so it is safe to give you this medication here. And we've already done a swallowing assessment earlier today, so I know that you are able to swallow.
Yes.
Okay, so I'm going to give you your pill here. There you go.
Thank you.
Here's your drink.
Thank you.
You're welcome. You can go ahead.
All right.
Awesome.
All good.
Okay, so just some special things with the medication. Just let me know if you feel like you're having any shortness of breath at all, any itchiness. It could mean that you're having an allergic reaction. The pain should subside within 20 to 30 minutes, so I'll continue to monitor you throughout the day. And yeah, so that's about it. Here is your call bell.
Thank you.
There you go. So feel free to ring me at any time that you need. And if you need anything at all, like no problem. Do you have any questions right now before I leave?
No, I'm good.
Okay, perfect. So I'm just going to get my pen here and sign my MAR. So I'm just going to write my signature. Perfect. Okay, so I'll be back to monitor you in 30 minutes or so.
Okay.
Okay, bye.
Thank you, Sam.
Just gonna wash my hands.